year on December 1st, the world commemorates World AIDS Day. We unite to bring awareness to HIV and AIDS, show support for people living with HIV, and remember those who have died from AIDS-related illnesses. Dade County Alumni Chapter of Delta Sigma Theta Sorority Incorporated have partnered with other organizations by hosting candid conversations and disseminating information to help educate and encourage our community to take steps to prevent the spread of HIV and AIDS. This year, DCAC and Delta Care Incorporated rocked the ribbon in global solidarity and shared responsibility with our local community and the world at large. Get the facts, know your status, protect yourself, stop the stigma, stand in solidarity.
Receiving the diagnosis of a life-threatening illness is devastating. It can lead to social, emotional, physical, and financial challenges. Fortunately, those diagnosed with HIV/AIDS have many resources available, including physicians, social workers, and counselors. Many years ago, if someone was diagnosed with HIV, it often led to a quick progression to AIDS, and as a result of a weakened immune system, further health complications. Healthcare has progressed with time. As it relates to HIV and AIDS treatment, it is important to know that HIV is treatable, but early diagnosis is key.
According to HIV.gov, approximately 1.2 million people in the United States are living with HIV today. About 1 in 7 don't know it and need testing. HIV continues to have a disproportionate impact on certain populations, particularly racial and ethnic minorities and gay and bisexual men. Miami-Dade County has the highest HIV infection rate and the highest number of people living with HIV and AIDS in Florida. The zip codes 33139, 33147, 33161, and 33142 have the largest concentration, followed by 33150, 33138, 33127, 33136, 33137, and 33141. Residents and visitors of other zip codes in Miami-Dade County should take the same precautions and path to wellness as these zip codes to protect themselves and help stop the spread in our community.
The CDC recommends everyone between the ages of 13 and 64 get tested at least once. It is important to know your HIV status to protect yourself and others. Testing is available with your local healthcare provider, the local Florida Department of Health, VA medical clinics, and other local organizations with both clinical and non-clinical sites. There are also at-home test kits available if that is your preference. Results from rapid tests are available in about 20 minutes, while standard tests take a few weeks. To determine your closest testing site, call 1-800-CDC-INFO or visit testmiami.org.
Thankfully, with the advancement of healthcare and more knowledge of HIV and AIDS, people live long, healthy, and productive lives when receiving treatment. The development of antiretroviral medication has allowed many people to live with HIV and experience minimal adverse health effects, including stopping the progression of AIDS. Effective treatment can reduce the level of virus in the body, and when the viral load is so low, the test cannot detect it. The person can no longer pass on HIV as long as they are continuing to take their medication.
It's time to stop the stigma. We can do this by educating ourselves on HIV and AIDS and changing the way we think and speak about people living with HIV/AIDS. You cannot get HIV/AIDS from working with an infected person, talking to someone, hugging or dry kissing someone, or even sitting next to someone. To prevent the spread of HIV/AIDS, get tested yearly or more if you're working or living an at-risk lifestyle. Know your risk. Monogamy, latex condom use, work precautions in high-risk fields such as people working with needles and blood. Take PrEP as a preventive drug. If you are high risk, diabetics should be sure not to share or reuse needles. I'm Karen. Stop the stigma.
2020 has been a year of unprecedented times. Though people living with HIV and AIDS have a compromised immune system, those maintaining treatment are protecting their immune systems. COVID-19 does not have adverse effects on this population as compared to others as of October 2020. However, it is very important for people living with HIV and AIDS to maintain care with their providers via telehealth or in-person visits, as well as maintain antiretroviral therapy.
COVID-19 has exposed health disparities in communities across the world. This is still true with HIV and AIDS treatment. We stand in global solidarity and shared responsibility with the international community this World AIDS Day. Every year, Delta Sigma Theta Sorority Incorporated renews its commitment to supporting the many people living with and affected by HIV and AIDS around the globe. Delta House in Eswatini, also known as Vashti Village, is a residential facility dedicated in 2002 for children who became orphans due to the HIV/AIDS pandemic. In honor of this 32nd World AIDS Day, join us by donating a minimum of $32 to the support and continued care of children affected by HIV/AIDS in Eswatini. Donations can be made via Zelle, check, money order, or PayPal using the information on the screen. Know your status, protect yourself, and let's rock the ribbon together.